Of course, good morning, Thursday morning to the citizens and residents of Dominica, and of course to the many volunteers from the region and extra-regionally, the various institutions, organizations, representatives from various countries and governments who are here helping us with our efforts as a result of Hurricane Maria. I want to especially recognize you. To this morning we have here Dr. Carissa Etienne, who is the director of the Pan American Health Organization, and her representative based in Barbados, responsible for the OECS including Dominica, and Nurse Augustine, who is the local representative for the Pan American Health Organization. Before I speak about the presence of PAHO in Dominica, I wish to inform the country that we have reviewed the curfew hours, which is currently set at 4 p.m. to 8 a.m. and the new curfew hours effective today will be set at from 6 p.m. to 6 a.m. in the morning. So 6 p.m. to 6 a.m. in the morning, that will allow folks to get to work on time or even before time, and allow you to get home safely and adequately. And of course, these times are being reviewed because by and large most people are behaving themselves, and the more we behave ourselves, or the better we behave ourselves, is the greater relaxed we will be with regards to the curfew. The Chief Police has advised me that he shall review these hours in the next 72 hours and advise me, then I will advise His Excellency the President on further amendments if needed or required in respect to the curfew hours. The state of emergency is still in effect, and that will stay in effect for some time. But I really want to first of all congratulate Dr. Etienne for her re-election as the director of the Pan American Health Organization. She's just started to serve, or very soon she'll commence her second term as the director, and with overwhelming support from the PAHO community. But we're very grateful to PAHO. PAHO fortunately was an island before the hurricane. So in respect to making immediate contact with the regional office in Barbados and of course the headquarters, that was certainly much easier if they had to mobilize from Barbados or mobilize from Washington. But PAHO has been exceptional in assisting us in rationalizing our health situation, advising us on matters we need to pay attention to, sourcing a lot of our pharmaceuticals and medicines, and ensuring that Dominica has adequate supplies, and where we're short, they have been able to source the specific medicines required on island. They've also been coordinating in large measure the external human resources in various areas, and helping to coordinate the presence of a number of health and medical professionals on island. We could say without any doubt, if PAHO were to be absent from this mix of assistance and coordination, we would not be where we are today. So we're profoundly grateful to PAHO, and of course under the leadership of Dr. Etienne, for the extraordinary commitment. We are overwhelmed by the demonstration and manifestation of commitment, concern, care, and the diligence of delivering those assistance to Dominica. And we will be eternally grateful to PAHO and the membership of PAHO for this assistance. Because for us, before the disaster, and especially post this hurricane, health remains the #1 priority for us. You know, these are times when all sorts of health issues can pop up, and therefore we have to be proactive and also take preemptive action to either eliminate the possibilities or manage the possibilities. And I think with the expert guidance and the tremendous experience, practical experience of PAHO, I believe we're in safe hands. And of course, coupled with our local medical and health professionals who've been doing a fantastic job. All of them have really redoubled their commitments to the citizens and residents of Dominica. And the passion and the love and the care which they demonstrate, which are all words to describe the health professionals. They really have dug deep to get all of these attributes and manifesting themselves in the practical way they go about providing care and attention to the patients. But of course, there are some things as citizens that we can do to minimize on the possibilities of health issues there. And Dr. Etienne and her team will speak to these issues in a more professional manner. But we have to watch what we drink, the water we drink, where we drink water from. You know, it's a time for leptospirosis and rodents and also all the wild animals and so forth. So we have to be very careful with that. The water which DOASCO is providing, we're ensuring that it is properly treated, it is safe, and so forth. So we have to be mindful of actions which we can take to prevent ourselves from contracting any waterborne or the diseases at this time. Again, I really want to thank the citizens of Dominica. This is a time for us to work together. This is not a time for negativism. Negativism will not bring us anywhere. As a matter of fact, it will keep us back. Negative energy, you need more time to carry it than positive energy. If something is not going right, or if from your perspective, what can you do to fix it? And if you cannot fix it yourself, who do you know who can fix it, and reach out to that person so that person can fix it? You know, a neighbor doesn't have water, share it with the neighbor. So when the neighbor gets, he could give you a bottle back and share what he gets. So it makes no sense we sit on our porch and criticize and say, well, I haven't gotten, go out, reach out, ask questions. The numbers that we have published, that you can message and say, look, I live on that street, in that village, in that community. My name is so-and-so, house number 4B, blah, blah, blah. We will reach you. You understand? We will reach you. Staying there and posting it on social media is not going to help you. It's not going to help you. The same time you're taking to post it on social media is the same time you can get to send a WhatsApp message or send a text to the numbers that have been published, so that we can reach you. To get to 72,000 plus people with our terrain is a challenge. You need literally thousands of people, volunteers, to get to every home. Because as it is now, in large measure, we're delivering supplies, delivering services to people at their homes. Because we have been searching for centers to have central distribution points so people could come and know the hours of distribution, but everywhere is mashed up. Every space that you could get in any village, if any proper size, is a difficult thing. We've been searching for storage facility in Rosal. We cannot find anyone. That place where we can use that is adequate, so we can say to people, go to this center on this street, open hours from 8 a.m. to 10 p.m. There'll be people there, you will get this. We have had to be on the road literally, packaging these items and delivering to people house to house. So it is not a simple operation that you can just rub a genie and everything is fixed. This is a practical operation that has all sorts of inherent challenges associated with it, and therefore we have to be understanding. So let us reach out, let's get going. If your drain is blocked with some galvanized, take it out, because you will cause water to settle, mosquitoes start breeding, and who is it going to bite? You. And who's going to get all sorts of mosquito related illnesses? Yourself. So we have to be mindful of whatever actions we take, positive or negative, is going to impact on us. And the question is, what kind of impact do we want on ourselves, our families, and in the wider country? I would want to think a positive impact, a positive influence, because we have a huge task. There are thousands of us whose home got affected, and we forgot to either pay our insurance or we refuse to have insurance. So, how are we going to help these people? So these are the things that we have to exercise our minds, on. There are people whose homes got crushed, literally to the ground. No insurance. And they are unable to go to the banks. They may have no security. They might be pensioners. And the pension is 2 times of what they earn monthly. And they would have retired 20 years ago. So whatever gratuity they receive, whenever you take it from monies in the bank and you can't put back, it will finish. So anybody who was retired 20, 40 years ago, I don't expect you to have the 100,000 which you got from government or from a private sector person. You'll have used up that. And with illnesses, all our family members are affected by illnesses, and we have had to pay significant sums of money to send our people overseas for medical care. So a lot of us are in the negative insofar as finances are concerned. But we've lost all what we built, all our working lives. And therefore we need to sit down as a nation to speak about these practical issues and to assist the government in addressing those issues. The private sector people who've invested significant sums of money, who've placed their homes, their private homes, as security. But the private homes got affected, and therefore they cannot go to the bank and leverage to the bank for additional resources. And how do we work with them to ensure that they do not send home the 30 people that they're employed, and to start business operation as soon as possible? So these are some of the practical things that we have to exercise our minds about, and not focus on any negatives or any complaining. I could have millions of complaints every day, but to what end? Who is it going to benefit if I am to complain about things I may not be satisfied with, or I think that I've fallen short, or this person has fallen short? Because we also have to understand too that every one of us is traumatized at various degrees. Because we all experience this hurricane. We all experience this hurricane, and therefore there are people who are still dazed, there are people who still cannot function, people who cannot face the reality, there are people who believe that they're still dreaming. It is not true, it's not real, that they're in a dream. And we have to assist these people. And it's the very same people who we rely on to provide us with services at the hospital. Most of the nurses and doctors lost their roofs, lost their homes, but they're there every day to ensure that when we get to the hospital, there's somebody to care for them. And we have to be grateful and thankful for these things. You see, for these things. Because while the Lord loves a cheerful giver, He also loves grateful people. And therefore, while we want to receive, we also have to be grateful for what we've received, and also to reach out to people. So it's a task. We are putting things in place to address some of the concerns with the private sector, with the homeowners, with agriculture, and to get farmers back into work. So there are a number of things that are happening behind the scenes, and those policies, those programs will be articulated as the days and weeks go by. But understand that, as I said yesterday, we have not earned $1 in the Treasury since the hurricane, but we have bills to pay. And these bills are coming up every day. And so one can appreciate the fiscal difficulties which this government will have to face, the country will have to face in the weeks and months ahead. Because if before the hurricane you had, as a small country, fiscal challenges, it is not now that you are unable to earn that you won't have fiscal challenges. So let us be grateful to the Lord that we have seen another day, and that there are people like PAHO and all of the major benefactors who have been assisting us in addressing our concerns. And we are optimistic. We are mindful of the global realities, but we are optimistic that we will get the help from the international community, and we will address some of the challenges our country faces. It's not going to happen tomorrow night. It's not going to happen next year. It's going to take us years, because there are countries who've had hurricanes 10, 15, 17 years ago, and they're still rebuilding. They're still rebuilding. Even in developed countries, far more small economies like Dominica, and where the majority of us may not have had insurance on the night of Hurricane Maria, and we are wondering how we're gonna get a roof back over our head. I will speak hopefully tomorrow on some solutions for housing that we are discussing. We're engaging companies, we're engaging countries, we're engaging institutions to find housing solutions that can withstand beyond Category 5, that meets all of the construction codes, that also addresses the seismic situation in our region, and ensure that, God forbid, something were to happen to us, and we continue to pray that it doesn't happen. But if it happens, then we're in a better position to withstand it. But thank you. I leave you in the capable hands of the Secretary to the Cabinet, Ambassador Farrell. But I really wanted to come in to express publicly our appreciation for Dr. Etienne, a daughter of the soil from Massac. You know, and we have to relocate a number of people from Massac, you know, because they're in the ravine there, and we cannot build back their homes there. So there are a number of communities that we have to relocate, you know, Kulibistri, Koliho, Massac, some parts of Maho, Campbell, the list goes on, Pishlem. And all of this, you have to build communities, homes for these people, infrastructure, schools and health facilities and public facilities. So we can appreciate the tremendous task that we have, and the tremendous burden on myself as the main fundraiser for the country. But God is good, and I'm sure the good Lord will bless us, and we'll get there. Not tomorrow night, but sometime. As I say, Rome was not built in a day, but it was built anyway, and therefore Dominica will be built day by day, but we shall rebuild Dominica anyway. So Dr. Etienne, thank you, and first congratulations to you. I envy your situation, you know, which I spoke to you yesterday about, and I may not want to say publicly, but I really want to congratulate you and for your impression on the community, PAHO community, and I think you have earned the respect and admiration of all of the countries and all of the institutions, even beyond the PAHO community. And we want to thank you for being here, your physical presence. You are here not only as a Dominican and concerned about the citizens of Dominica, but you're here also as the director of the Pan American Health Organization to say to us in Dominica, the people of Dominica and the residents of Dominica, that PAHO will be there with you now and in the foreseeable future. Thank you very much, and God bless you.
Okay, good morning to all. Dominican nationals, agencies, Dr. Etienne, Rep from PAHO, Mrs. Augustine. PM has done an excellent introduction, so it's my task to just continue with part 2 of our press briefing today. It's a new day, another day in our recovery, rebuilding mission. And again, we do what we do all week, appeal for calm, for tolerance, for respect. Each day brings with it its new and independent challenges. Those we discussed yesterday are gone. We have new ones today, so I appeal to all. I want to thank the volunteers who are here with us. I want to thank all of the public officers who are serving. I want to thank all of the agency. So far this week, we've had a broad range of matters discussed with you. I think we did banking and business on Monday. We did access, roads, telecoms, and electricity, water. On Tuesday, yesterday, we did distribution, and we heard from the various international UN agencies that are here on the work they've been doing so far. So today, as Prime Minister said, we go again on health matters, and we did have some briefing on health before, but as you know, health is with us and it's going to be continuous, and I think today is one of many more to come at both the national, regional, community perspective. And today we have with us, as PM has mentioned, Dr. Carissa Etienne, Director of PAHO, and the rest of the briefing is really belonging to her. She's going to give us the PAHO perspective and probably highlight and update us on some of the work that PAHO has been doing and is doing in Dominica, particularly post-Maria. I will invite Dr. Etienne to the podium to address us and to update us. Thanks.
Thank you and good morning. No matter how our country looks, it is good to be home. And let me say that Dominica for me still holds the same charm that it held prior to Maria. I want to begin by truly commending the people and the government of Dominica, the Prime Minister and his cabinet, on the work that has been done thus far, following what is one of the worst disasters in recent history, and a disaster that is compounded by our terrain, a disaster that was compounded by the lack of communication, and still the difficulty in accessing some communities. From health, I also want to commend the health staff. The health professionals of Dominica have paid really yeoman service to this country, working even when they themselves had suffered losses, and even bringing patients into whatever was left of their homes to deliver services and working long hours. So I really would like to acknowledge and commend those healthcare workers. We are here as PAHO, and our responsibility all over the Latin America and Caribbean region as it deals with emergencies is to prepare our countries to face emergencies, but in the immediate aftermath of a disaster, to be there. If we can pre-position, we do, to help with the immediate response and also to help towards recovery and rehabilitation. So we were here, as you heard the Prime Minister, from the first day, and immediately we began to mobilize for the response. Our work is not to work as an entity, but to work closely with the Ministry of Health and to help with the coordination of the health response, taking into consideration all of the assets that are available from neighboring countries, from entities who are on island and also off island. So this is what our responsibility is under the UN humanitarian arrangements. I have met with the Chief Medical Officer, with the Minister of Health, with the Permanent Secretary, the Director of Primary Healthcare Services, and all of the managers of the Ministry of Health. I met them in the OSC yesterday and had private meetings with them. So the update that I will give you is based on those meetings that I've had, and certainly the information that was given me by these officers. Important to note that in terms of services, that the hospital service is about 80% functional, and this is tremendous, recognizing that the hospital had suffered significant damage and loss of water and loss of electricity. It is 80% functional. There is a reduced bed capacity. All the major specialties are functional, except very limited oncology. The dialysis service has been restored. The laboratory is not fully functional in that they are not able to do some tests, what we call the chemistry tests. That is because they require reagents. So PAHO is making the arrangement to get those reagents so we can be fully functional in the laboratory. We also had to work with them to secure blood, and we can report that today the blood has arrived from Barbados, so there is access to blood on the island as well. Working on the primary healthcare system, all the type 3 health centers are functional. In respect to Marigot, the accident and emergency services are being delivered from Wesley. The report that we received from the type 3 health centers indicate that they are fully stocked with regards to medicines. So they are fully stocked. However, we've requested that another analysis be performed, given the fact that many persons may have lost their supply of medication, particularly for those who are chronically ill. There, in some of the Type 3 health centers, we have seen some additional staff, some volunteer staff, both in terms of medical and nursing staff. I think more could be done there if we were able to identify some accommodation for volunteer health staff, because we do have many countries volunteering to send staff, but it is very difficult to send staff to Type 3 health centers without any accommodation. So if that could be done, then PAHO can work with the Ministry of Health to make this available. I need to say something about volunteer medical and nursing staff. Remember that no one can just come onto the island and begin operation as a medical doctor or as a nurse, that all of this has to be coordinated with the Ministry of Health. We need to ensure that the people who are coming here with a stethoscope around their neck and claiming to a doctor, that they are truly doctors and that they are able to be registered. So this is another layer of protection for the people. I think it's important also to stress that the Ministry of Health staff at the hospital and health centers have been working flat out. Some of them lost their roofs as well, and so we have helped. PAHO has helped to give them some tarps so they could do some temporary sheltering of the houses. But it's going to be important to ensure staff welfare for them, because if they must be in the areas of work all day, they do not have the possibility of going to look for themselves. So we are developing with the Ministry of Health a schedule for the replacement of staff, because by now you know that staff is truly, some of them almost burnt out, very tired, having worked all of these hours for so many days. In terms of drugs and medical supplies, I did tell you that your Type 3 centers, the 7 reported full stock, and we are assessing that. Central Medical Stores does have large quantities of what they require in terms of their normal stocking. There is some work that's going to be done in Central Medical Stores to ensure that all of the supplies that they require are actually in stock. And so there are 2 people that will be hired by PAHO, nationals who've had training in supply management, that will go with Central Medical staff to ensure that we do have all of the variety of drugs and medical supplies that will be required. We have lost all of the vaccines in country because the cold chain was interrupted because of loss of electricity in all of the facilities. Therefore, all of the vaccines are not usable. So PAHO we are working now to develop a project for the funding of vaccines for the country for a year, and to look into and assess the cold chain and ensure that there is cold chain refrigerators and vaccine carriers, etc. We listen to health education and health promotion, and there are messages that are already being broadcast, and also by telephone. It's going to be very important that people listen to those messages. They're also going to be doing some loud hailers within communities to spread the message, and deploying a number of persons, redeploying them from what they are doing now to do community education, yard to yard, house to house education. And PAHO is assisting with that, and the possibility of having some printed material. It's going to be very important, because persons survive the hurricane, they must ensure now that they remain healthy and that they survive. So messages like boiling your water, and unless it is bottled water. We have brought in some 60,000 water purification tablets, and each tablet can purify like 5 liters of water. So we are also asking people to go to your health facilities to access these water purification tablets. We need to reduce mosquito breeding sites, particularly the Aedes aegypti mosquito, which breeds in and around houses. With this amount of debris around, it's going to be very difficult to do that. But every householder has to be responsible for cleaning in and near his house. As the Prime Minister said, drains that are blocked, we should organize community action to take care of this. And we are also doing treating of mosquito sites. Remember, Aedes aegypti, we have to think of dengue, we have to think of Zika, and we have to think of chikungunya. Many of those are important. We have, because there is no refrigeration, we also have to caution people to avoid eating spoiled foods. So small quantities, so that's why you don't need to have supplies for 10 days or 10 weeks or 2 months, because you already can only prepare small quantities of fresh foods especially. We need to caution people to wash their hands very frequently, even though water is not readily available, but try, for those of you who can access the purifying hand washing, hand purification, or hand sanitizers, then please do that. And you need to wash all foods before eating. Even the cans, you need to wash the top, because of course one of the things that we are looking at is to avoid leptospirosis. So there are many rodents here, lots of rats and mice, and their urine and their dropping will spread leptospirosis. So we need to prevent this from happening. So also, because we are getting a lot of canned foods, we have to make sure that we dispose of those cans properly, because cans left lying around will become breeding sites for the mosquitoes. We are also working with the Ministry of Health on surveillance of the work that was done early in surveillance is surveillance of injuries, and so we worked with them. Now we're also moving to step up on communicable diseases. Some of those diseases that we keep under surveillance includes gastroenteritis, other forms of diarrheal diseases, rodent-borne diseases like, example, leptospirosis, and respiratory conditions. It is anticipated that all of those are possible as we go into the future, and so we need to look at this. In terms of water safety, PAHO is working with DOWASCO and the Environmental Health Department to test the water supplies. And when they say that this water is safe, it is because we've conducted those tests, and that the water can therefore be used. So that's going to be important. The vector control, the report that we received from Environmental Health is that they've begun with mosquito control, and very soon they will begin the fogging measures. And the rat poison is being distributed as well. And these might sound as they are simple, but they are rather important to preserve the health and to prevent disease that comes in the wake of such disasters. I want to say that in the immediate after effect, that we were very involved in restoring the services, the hospital, making an assessment, restoring the hospital services in terms of dialysis, some of the laboratory facilities, etc. And the same thing for some of our type 3 health centers. We helped to evacuate 16, 17 patients. We were very fortunate that the Dominican Republic made this accepted to both move and take care of our patients. 11 of those are back on island. We also help with the evacuation of one person to Martinique, and then from Martinique to Trinidad, and another person to Barbados. So at considerable cost, but not at cost to the government of Dominica. And we are now helping the Ministry of Health to come to terms with the fact the disaster is over. It's almost over. The disaster is over. The response phase should be winding down. We now have to begin to look into how do we normalize some of those services that we have. And so to that regards, in about 2 weeks' time, we will work with the Ministry of Health to do a full assessment of the services themselves, not just facilities, but the services that are being delivered and the quality of those services. And also to begin taking a much longer term perspective in the rebuilding of those health services, not just facilities and where those facilities are sited, and the fact that we need to make smart facilities, but importantly, how do we organize the primary care services, for instance. I need to tell Dominica that it was out of David that a primary care system was born that was the envy of the world. So despite the destruction, we can plan into the future to have a health service that will serve the people of Dominica adequately, and certainly at a much higher level than now. The garbage and waste and solid waste disposal, that is extremely important, and to the extent that we can, we will continue to work with the Ministry of Health on this. I want to take this opportunity also to speak about the responsibility of the citizen and the responsibility of each person. The Ministry of Health cannot be, or PAHO, can't be responsible for your own health. You have to take that responsibility for your own health. And we want to make a particular plea to patients with chronic diseases. Patients with chronic diseases must take their treatment every day. And so we need to say that this is not a time to suspend your treatment or to forget to take your medication. This is a time that you need to make sure that you have stocks. If you don't have, then go to your health center, your type 3 health center, and get stocks so you can take your medication every day. And also responsibility in terms of taking care of your health as an individual, and observing many of the messages that are being sent out by the Ministry of Health, but importantly being your neighbor's keeper as well. And so that's going to be very important if, as a people, we are going to ensure that we can recover. So let me say that let me conclude by really thanking all of those in the health services. I am a Dominican. I have seen many countries with many disasters, and PAHO is always there. We pride ourselves in that within 48 hours we are there in every country that has a disaster. And frankly, I am proud of what has happened thus far in this country. This is a country whose low middle income or middle income, but with limited resources, and we've been able to coordinate the action. It's not perfect, and so we need to acknowledge that it's not perfect, but that a lot has been done. So let me say that from the halls of Maria will rise a stronger health system, and PAHO is committed to work with the people and the government of Dominica to ensure that we do have a health system that, just like after David, that will be the envy of the world. So thank you for allowing me this opportunity, and it's so good to be home. Thank you.
Okay. Well, it's now time to conclude our Thursday press briefing. And every day gives us an opportunity to say thank you. And apart from thanking Dr. Aiton, I think it's Dr. Shrub, isn't it? And Mrs. Augustine, the PAHO team, and the work that PAHO has been doing on the island, we should take this opportunity also to thank the management and staff of the Ministry of Health. I've been in constant contact and briefing with the Permanent Secretary of the Ministry of Health, and we know of the tremendous task that still lie ahead and the daily challenges that the Ministry faces as it starts to restore health services in most of our communities. I want to thank the volunteers who are here with us. I want to thank the agencies who are serving us. I want to thank the general public again for joining this task on this new day. We obviously need a new conversation. I think Dr. Aiton stressed on personal responsibility. We need a new conversation, a new post-Maria conversation. We need to start working again. For those of us who are back in offices, it's time to do things differently. For those of us who have offices who have to be relocated, offices that are damaged, we need to rethink, but it's still a good opportunity to produce better, to serve better, to care better. And out of the ashes, not only a better health system, but I think a better Dominica remains a divine opportunity, and I think we should make every effort to make use of it by supporting each other, by respecting each other. I say it every day, every week. As Catholics, we do the rosary about 100 times, so repetition is a thing that's in our blood. So please, we appeal to people to be patient, to the traffic, drivers. I know we have a lot of issues with drivers and the congestion in the roads, though. We ask you to be tolerant. We ask you to respect the direction of the police. We ask you to also remember that the people who are serving you at the centers, they themselves, as the PM said, are attending to their own loss, so that we must really never forget to be tolerant and respectful. Thank you again for joining us, and we'll be with you tomorrow with another briefing session. Thank you.